She was told it was nothing, just stress, just a hormonal thing that would sort itself out. 6 weeks later, that nothing turned out to be a stage 3 cancer that had already started to spread. I'm Dr. Priyanka Mathur, and today I want to walk you through exactly what happened to that patient step by step, because the mistake that almost cost her everything isn't rare. It happens every single day to people who have good doctors, good insurance, and no idea anything is wrong until it's almost too late. And by the end of this video, you're going to know exactly what to listen for in your own body and exactly what to say to a doctor if you even feel like you're being brushed off. Let me start with her because this isn't a hypothetical case. I'm identifying details to protect her privacy, but everything about the medical timeline is real. She was in her early 40s, busy, healthy by every normal measure, no family history, not anyone had flagged as a concern. It started with something almost embarrassingly minor, some pelvic discomfort, a little bloating that came and went, and a change in her cycle that she chalked up to being in her 40s. If you ever felt something in your body that was just slightly off, not dramatic, not an emergency, just off, you already know exactly the feeling I'm describing. She did what most responsible people do. She went to her doctor, she described the symptoms honestly, and she was told reasonably that this sounded like a hormonal shift that's extremely common at her age. She was given a plan to monitor it, told to come back if things got worse, and sent home. I want to be really clear about something here. That wasn't bad medicine. Statistically, that explanation is right far more often than it's wrong. That actually part of the problem I want to unpack today. 3 weeks later, the bloating hadn't gone away. If anything, it was worse. She went back. This time, a different explanation came up. Possibly a digestive issue, maybe something related to diet. She was given some dietary adjustments to try. 2 visits in 2 reasonably defensible explanations, and still nobody had actually looked inside to see what was going on. This is the part I really want you to sit with because it's the exact pattern I see over and over in cases that come to us far more advanced than they needed to be. Each individual decision along the way made sense on its own. It's the accumulation of probably nothing that becomes dangerous. Here's what changed. A family member of hers had completely separately gone through our concierge process the year before for an unrelated issue, and when she mentioned she still didn't feel right, that family member encouraged her to get a proper second opinion, not because anyone suspected cancer, but simply because 2 visits without a clear answer is exactly the point where I always tell people it's time to escalate, not wait. When she came to us, here's exactly what we did differently. And I want to walk you through this clinically because this is the actual mechanism, not just a feel good story. The first thing we did was order a transvaginal ultrasound and a CA-125 blood marker test. Neither of these are exotic or expensive tests. They are not even hard to get. What they are is commonly skipped in a first or even second visit, specifically because the symptom was overwhelming, like to be benign, that ordering an ultrasound for every patient who describes them would be considered by normal clinical protocol overly cautious. That's the uncomfortable truth at the center of this entire story. The standard of care isn't broken. It's built around probability, and probability means sometimes the less common but more serious explanation gets missed simply because it wasn't the statistically likely first guess. The ultrasound showed a mass. The CA-125 came back elevated. Within just 4 days, she was in front of gynecologic oncologist, a subspecialist who deals specifically with exactly this kind of finding, not a general practitioner, not a general oncologist making a best guess, but someone whose entire practice is built around this one area. That's the second thing that changed. It wasn't just that the test got ordered, it's that the right specialist reviewed the result within days, not weeks. Staging scans followed most immediately after that, which is what confirmed it was already stage 3. Now, I know what some of you are thinking. I want to say it plainly. Stage 3 is serious. This isn't a story where I tell you everything turned out perfectly and there's nothing to worry about. What I can tell you is that finding it at stage 3 instead of what would very likely have been stage 4 within another 2 or 3 months of let's keep monitoring it completely changed her treatment options. It meant surgery was still viable. It meant she qualified for treatment protocols that simply aren't available once a cancer has spread further. The 6-week gap between her first visit and her diagnosis wasn't the difference between sick and healthy. It was the difference between having options and running out of them. So let's talk about why this happens, because I don't want you walking away from this thinking your doctor did something wrong or that you can't trust the healthcare system. That's not the lesson here. The real issue is structural. A standard primary care visit in most systems runs somewhere between 12 and 25 minutes. In that window, a doctor is working through most statistically likely explanations first, which is exactly what they are trained to do, and exactly what keeps healthcare functional at scale. The problem isn't the individual decision, it's that there's often no one whose specific job in that moment is to ask, but what if this is the less likely explanation? And what if we need to check to rule that out completely? That question, what would this look like if it were the serious version, and what specific test would rule that out, is the single most useful sentence I can give you in this entire video. I want you to actually remember it, maybe even write it down. It's not confrontational. It's not accusing your doctor or missing something. It's simply asking them to think out loud with you about the edge case, not the likely case. So here's how I'd suggest using it in real life. If you have had a symptom looked at twice and you are being told a reasonable explanation, but something is in you still feels uncertain, that's exactly the moment to ask that question directly. Something as simple as, I understand this is probably X. If it weren't X, what's the more serious possibility? And is there a specific test that would rule that out? Most good doctors will respect that question, and many will actually order the test on the spot, simply because you asked directly rather than them having to guess whether you wanted that level of investigation. The second thing I'd tell you is 2 visits without a clear confirmed answer, not a guess, an actual confirmed answer is my personal rule of thumb for when it's time to get a second opinion from a specialist, not just a repeat visit to the same doctor. Not because anything is necessarily wrong, simply because at that point, a second set of eyes, ideally someone who specializes specifically in the area of your symptoms falls under, cost you very little and can save you months. This is exactly why I built our concierge process the way I did. It's not that we have access to secret medicine nobody else has. It's that when someone comes to us, we treat, I still don't feel right as a reason to move immediately to the right specialist and the right test rather than as something to monitor for another few weeks, then coordination. Getting the right expert in front of the right case within days instead of months is often the entire difference in outcome. If you or someone you love has a symptom that keeps getting explained away and something in you still isn't settled about it, I want you to, at minimum, ask your own doctor that question I gave you today. And if you'd rather have a physician led team take a direct look at your case and coordinate the right specialist from the start, that's exactly what we do at MediPocket. And there's a link below to request a private case review. Take care of yourself. I'll see you in the next one.